We could soon be armed with new ways to protect the population from COVID-19, which is good news as the cooling temperature forces people back indoors. University of Ottawa epidemiologist Raywat Deonandan is joining us this morning. This is a fascinating topic. So American pharmaceutical company Merck has just announced the results of a study into a potential oral antiviral drug. This would be to treat COVID. And according to the company, about 7% of COVID-positive people who receive the popular drug, I'm going to let you pronounce it, molnupiravir. Yeah, were either hospitalized or died from, it's new, died from the virus. That's compared to 14% who received a placebo. So the company says they're going to seek emergency authorization from U.S. regulators. So how promising could this drug be against the fight of COVID-19?
Right. So we haven't seen the actual data yet, just the press release. And as you mentioned, it halves the risk of hospitalization and death, which is great. Not as good as a vaccine. Vaccine does much better, but it's pretty good. And the most important part to me is that this is an oral pill. You take it 2 times a day for 5 days as soon as symptoms arise. And that means you can be treated at home. The other treatments we have require an IV drip that has to be done in the hospital. So from a management's perspective alone, this is pretty important. Now, the thing is, we don't know if it works on children. We don't know how well it works on vaccinated people, and probably doesn't work that well on seriously diseased people. So the thing about antiviral drugs is you have to give them early in the disease cycle. But it's an important new tool. It doesn't replace vaccination, but it can help fill the gaps until we get more people vaccinated.
And as you point out, very early stages and very early data right now. There is, however, some promising news on the COVID front. Pfizer submitting the data on its vaccine for kids under the age of 12. That's went to Health Canada now. Talk to us about the importance of getting young kids vaccinated as soon as possible, especially now that school is back.
Yeah, I wouldn't say as soon as possible because there's still a lot of parents who are skittish about vaccination, and we don't want to push them aside by having them feel coerced or compelled. But it's pretty important. And in absence of vaccination for these kids, we have to keep on focusing on non-vaccination interventions like mask wearing, HEPA filters in schools, rapid tests, and making sure all the adults they come into contact with are vaccinated. But if the kids can get vaccinated, well, that is a bit of a game changer again. It means the kids will be less likely to get sick, obviously, less likely to pass it on to their parents, obviously, and also allows us to have the herd immunity conversation, which up till now we have not been able to have.
Finally, as it gets colder outside, people are going to start to gather indoors more. You know, our open air gatherings are coming to a close. New modeling from Ontario's Science Table is suggesting that the province of Ontario, at least, could see 1,500 cases per day by the end of October if current transmission rates continue. So even with our vaccination rates high, what's your prediction on how winter could compare this year to last?
This is a tough one. It comes down to the super spreading environments like restaurants and bars and nightclubs, which now have the vaccine passports preventing the unvaccinated from gathering there, and that should prevent the super spreading events. On the other hand, churches, shopping malls, private homes are not controlled by vaccine passports. So it comes down to where the unvaccinated will gather and whether they will gather. What I anticipate is that we will see spikes and explosions of cases unevenly across the geography because immunity, vaccination is not evenly distributed across the population. So expect some growth in some areas. Takeaway message is always get vaccinated if you haven't already been vaccinated. That is our way out of this.
Dr. Deonandan, always great to speak with you. Thanks for your answers to our questions this morning.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.